If you've had to wait months to see your doctor or traveled for hours to access care you needed, you've already experienced what physician shortages mean for residents in our area. So I met with local, state, and federal healthcare leaders to find out how they're hoping to address this issue and prevent it from getting worse.
We're at a deficit now in healthcare providers locally, and that deficit will only get deeper and deeper if we don't act today.
For the Northwest Arkansas Council's Ryan Cork, keeping healthcare accessible for residents is a race against time. He says the area's population is expected to double over the next 2 decades.
Our need for the health care to grow at the same pace, and in some cases outgrow our residents' pace, is there today.
Cork tells us Northwest Arkansas is already struggling to keep its patients as they're forced to travel for care, and that travel is costing the region.
Every year, $1 billion.
It's not just money the area is losing, but its future workforce. In 2021, Arkansas graduated 200 more medical students than it could move into residencies.
And so right off the bat, regardless if you wish to stay, there wasn't a spot for you to stay in. And so we were then shipping 200 young physicians that just graduated medical school out of state.
Heart rate is 154. Hello, sir.
Cork believes creating more residency slots for med students like these in the River Valley is the state's best path forward.
Draw back. Good. Got blood.
According to the Association of American Medical Colleges, doctors end up working in the state where they did their residency over 50% of the time, something a current vice dean at UAMS, Dr. Molly Gathright, has experienced personally.
I felt the need to give back to a state that really had invested in me.
But now that Gathright helps lead graduate education in the state, she says there are a lot of roadblocks.
We can't just wave our hands or our magic wands and say, poof, we need a new residency program.
Okay, we need the quotient.
Training a resident costs around $150,000 every year, and the federal government helps hospitals afford these costs, but puts a cap on how many residents it's willing to support, even if the hospital continues to grow.
So it becomes harder then to add more residents because there's not CMS funding available above that cap.
With these caps set decades ago for the state's major hospitals, Arkansas's medical leaders have to get creative. Washington Regional reclassified as a rural hospital to raise their cap. While this can only be done once, the result was 92 more residencies and new opportunities.
Internal medicine residency programs. We're going to start neurology. We're going to start emergency medicine. We're going to look at having general surgery.
Other solutions may be getting their start in Little Rock, where Representative Lee Johnson helped create a system to distribute future funding for residencies.
The challenge has, been trying to find funding to launch that program.
And at a federal level, Senator John Boozman says he's trying to raise the overall number of residency slots available and introduced bipartisan legislation to change how these slots are given.
All of these things work together. And the good news is that I think that we are in that process working very, very hard, and as a result, it's going to pay off in the future.
And for the growing number of Arkansas patients looking to access care they need, that future can't come soon enough. Now, we should note, it takes several years for residency programs to start up and several more years for residents to become doctors. So tomorrow on KNWA News at 10, we'll introduce you to a program that may help Arkansans in the meantime, an investigation that took our team across state lines. Perry Elliott-Arani, KNWA Northwest Arkansas News.